UNICEF says it's concerned about the rise in unvaccinated children in the northern states of Kano, Jigawa, and Katsina. The organization says about 600,000 children in Kano alone have not had a dose of vaccines.
We in UNICEF we are very much concerned about the zero dose number of children in the three states of Katsina, Jigawa, and Kano. Basically, we are concerned because this is a basic, fundamental human rights, a child rights, in terms of having access to immunization services. And we know that globally, children are dying because they are not having access to preventable disease vaccination. And this is a major concern for us in Nigeria and in Kano in particular. And so we are sending the message, we're raising the awareness, we are calling for every community leader, for the media, for the policymakers, and to put hands together. We are building a partnership to try to reduce the high number actually, of children who are not immunized in the three states. We are talking about the 600,000 of children who are not immunized against the killing diseases.
We're joined now by UNICEF's Chief of Health in Nigeria, Dr. Eduardo Celades. Good to see you and thanks for your time. Let's start off first by looking at the vaccine hesitancy you spoke about. Let me quickly share with you an African proverb. It says, if you're burnt by fire, when you get to see the ashes, you run.
You run.
So for people of Kano State, 1996 still sticks with them.
Yeah,
the
with
Pfizer trial
incident
that went really bad. So what's UNICEF doing to ensure that people can actually get that very ugly situation out of their minds and start to embrace vaccines?
Right. Well, first of all, thank you very much for inviting us here tonight. Just to say that the report that has been launched today is the most comprehensive report ever about vaccination and immunization. And it's the first one that is launched after COVID-19 pandemic started in 2019. So that's why UNICEF wanted to look to the data, what the data is telling us, what is happening, what is the big picture. And what we are seeing is like over the last 3 years, the number of zero-dose children, the number of children not immunized globally has increased dramatically. Now we have 67 million children not vaccinated at all. The second country in the world with more is Nigeria with 2.2 million children. So you're asking for the reasons of what we can do. We are seeing two main reasons. One is weak health systems. You know that our primary healthcare systems are weak. We don't have enough nurses, doctors, midwives, commodities, good infrastructure. So this obviously affects access. People, they want to do the vaccine, but they cannot access to it. Not only in the north for insecurity or violence, but as well in urban slums, for example. The second one you pointed out is vaccine hesitance. Right? There is like fear, there are rumors. And I didn't know the proverb that you just told me. I will learn it. Thank you very much for that. But we believe that we need to be working at community level with the communities, traditional leaders, religious leaders, people of the community, at that level, at grassroots level, right? So we as UNICEF is what we are trying to do, and we're working with more than 14,000 community mobilizers to try to achieve that.
And I wonder how they're responding to your reaching out to them. Are they cooperating at all? And then what are the consequences of failure to vaccinate children, especially in the years to come?
Yes, we are seeing actually that yes. So most of the people, they want to vaccinate the children because it shows love and respect to their families, etc. So we are seeing that. And the risks are there. Just think on the measles outbreak that the country was facing last year, the largest outbreak of measles in the world, 20,000 cases only in the first quarter of last year. This year, after the vaccinations campaign of quarter 3 of 2022, the cases, they moved from 20,000 to only 2,000 in the first quarter. So we know that vaccines work, right? From reaching 25 million children gets results. Still, what we are seeing, diphtheria outbreak in Kano and in Lagos. We are seeing in Jigawa the meningitis outbreak. We are seeing now the cholera outbreaks. So vaccines work. Let me just give you an example. In the diphtheria outbreak, we are seeing that the children that they are getting infected and they are dying, they are from 5 to 10 years old. So these are children that they were not vaccinated 5 or 10 years ago. So sooner or later, the disease catches you. So this is my appeal to everybody seeing us tonight, that really to vaccinate the children if they love and care about them.
But you talk about primary health care, sorry dear. Primary health care, the need to strengthen it at that level. That's a very, very fundamental. What advice are you giving, especially to governments, whether the state and tertiary, the federal government? What advice are you giving to the governments at the different levels to strengthen the primary health care?
Correct. Look, if you ask me for the single measure that will have more impact, I will tell you human resources at both primary healthcare level and community level. Right? Maybe at tertiary, at a university hospital, it's good to have doctors, but if we don't have doctors where the people get sick, right, in their communities or in their primary health care, how we're going to respond to the main killers, malaria, diarrhea, pneumonia. So the most important thing that we need to be doing is human resources at community level, the chiefs or community health workers, but as well nurses and doctors. The second one is financing. Right? We need to have adequate financing of a strong primary healthcare system. And this is the long-term vision that I believe that if we do that together, government, partners, other actors, we can really succeed.
Well, now quickly, let's see how well you're working with collaboration, specifically the rural areas. Because it's amazing that Lagos was not immune to diphtheria when it broke. So are the communities also working with you to sensitize their people?
Yes, we are seeing that. We are seeing really that the communities are engaging, that they are eager to get vaccinated. Of course, we have pockets, right, of people that have hesitance. We can see that, for example, some fatigue after numerous campaigns. Sometimes it's happening, but we have mechanisms to do that, right? We have like follow-up visits. We engage with the community leaders, traditional leaders, religious leaders, so we can change the narrative about the vaccines in these pockets. But the main issue is like we're not going to control these outbreaks until we don't get to the leaving no one behind, until these pockets of communities that they are not vaccinated. What we are doing, we have done a granular analysis with government and partners or where these pockets, these communities are. We have identified 100 LGAs, about 1,000 wards where these communities are, and we are now going to target them with outreach vaccination teams to really target these children.
And in your report, I mean, it's curious to find that one of your findings, had to do with drug-resistant infections. How much of a concern is that for you, especially in countries like Nigeria?
Well, in general, yes, this is growing globally, the drug resistance to disease. We're focusing on trying to prevention is better than cure. Right. I can share that. I don't know if it's from my country or from which country, but this is a universal slogan.
It's global. It's universal.
It's a global slogan. So, for example, just thinking cholera, right? That we are starting to see new cholera cases. We need to prevent that. Having adequate water, adequate sanitation is much better than having to put a treatment center for cholera, right? Or to having to bring drugs, etc. So we believe vaccines is the most powerful tool that we have as human beings to reduce child mortality. Let's use it.
All right, and that's a good place to leave it. Eduardo Celades is UNICEF Chief of Health in Nigeria. Thank you very much for the work you do, and thanks for joining us on Newsnight tonight.
Thank you very much.